All right, for this lab, we're going to be looking at the parts of the heart, the structures in the heart, and right around the heart. These are critical for you to know for the lab practical. They're critical for you to know for everything. We're going to do the peripheral blood vessels later. Right now, we're doing the heart itself and the blood vessels that are right around it. Now, I've put a file on your computer in your Canvas site. It's either called Heart Parts or Cardiac Structures to Know. I think that's what I finally labeled it. But anyway, it has the list of things that I want you to be able to identify on the lab practical. There are a lot of structures in your lab manual and on the top hat sites that you're going to learn, that you're going to work with. But these are the ones I want you to concentrate on and be able to identify on the lab practical. So you can narrow your focus a little bit instead of every structure that was ever invented by anybody, and instead look a little bit more closely at the ones that are going to matter to you the most. So here's the heart. And maybe we'll use this one, since it's already off its stand. So here we're, and you know, you've got good pictures, and even of these same models probably in your lab manual, but seeing them on the actual model is really helpful, because these are the models that are going to be on the lab practical. If you were in the class, we'd have them sitting around all over the tables, but as it is, we'll have pictures of them, and you'll be identifying the structures that way. Get as much light as I can on the subject. I'm going to go through the list, make sure I don't forget something. This is the base of the heart, where all of the plumbing is coming out. The apex is the pointy end down here. Here is the left ventricle and the right ventricle. Here is the septum, or the interventricular sulcus, that goes down the middle. We have the right and left atrium, right and left ventricles. Remember, facing you is your subject. So this is my right, so this is my right ventricle. This is my left, this is your left ventricle. These flaps here on top of the ventricles are extra baggage, extra bags. So when the atria, when the atria really fill up with extra blood, there's room for it. These are called auricles because they look like an ear, and aura means ear. So the auricles are the flap on top of the atrium. The atrium is actually the hole in there. Take off the front. Looking inside again, we can see the right ventricle and left ventricle. The left ventricle is much more powerful, much thicker. These are papillary muscles. These things sticking up in here that attach to the chordae tendineae. These are chordae tendineae. They're easy to recognize. They look like cords. And they are holding the cusps. The cusps or flaps of your AV valves, the tricuspid valve and the mitral valve. Those cusps would flap up in the other direction and let blood go the wrong way if they didn't have some support. They're supported by the chordae tendineae attached to the papillary muscles. Here is the atrial septum, or interatrial septum. It's just the wall between the right and left atria. You can only see it from the outside here. Here is the interventricular septum, big, powerful wall between the two. It mainly helps squeeze the left ventricle, which needs so much extra pressure. Again, you have the tricuspid valve and the mitral valve coming down from the left atrium here into the left ventricle. You have the pulmonary semilunar valve going up into the pulmonary artery. It's leaving the right ventricle. And you have the aortic valve, the red one there, aortic valve that leaves the left ventricle and goes into the aorta. The walls of the heart, or you have the endocardium, which is this little pink layer, very thin layer that's on the inside of the ventricles. The myocardium is the muscle layer in the middle. The epicardium is the outer layer of the heart wall itself. The pericardial sac is a bag that goes around it. It's not shown here, otherwise you couldn't see the heart. I'll have a bag of some kind, or we might use a sheep heart or something that still has the pericardial sac on it in the lab practical so that you can find the lab, that structure. The cusps of the valves, again, are the little flaps of the valve. This is the tricuspid valve. It has 3 cusps. Those cusps are attached to the chordae tendineae, which attach to the papillary muscles. Semilunar valves, pulmonary and aortic valves. The cardiac circulation starts out with the left coronary artery and the right coronary artery. They don't show especially well. Well, here's the right coronary artery. It shows just fine, coming off the right side of the aorta, and goes around the back and down the bottom. That's the right coronary artery, or RCA. The left main comes off right underneath all this stuff, and it ends right there. The left main coronary artery then splits and goes down the front as the left anterior descending and left interventricular arteries, and the left circumflex, which goes around the left side. A little bit easier to see with it on here. The left interventricular, I'm not telling you as well as I should. It's hidden behind here, the left main. Let me show you on maybe we've got a picture of it that works better, but maybe not. I think I've got a better picture of it on my the lecture video. Anyway, let's start over. The right coronary artery comes off the right side. The left, right behind here, comes off, and it splits and goes down the front. Okay? The left anterior descending goes down here. This is no longer the left main because the circumflex is already broken off the side of it. Left circumflex goes around the side. Left anterior descending goes down the front and becomes the left interventricular. So you have a couple of different blood vessels down here that can block up. Those are very common ones to have heart attacks, to get blockages in. The left circumflex is what comes around the side over here. I pointed this out incorrectly before. Here's the left anterior descending, left interventricular. Here is the left circumflex. It keeps on going, but coming down off of it is the left marginal. That's the name of the one that goes down the side of the heart, is the left marginal. Because these are on the left ventricle, they are susceptible to heart attacks. More people have heart attacks on the left side than the right because the pressures are higher and the work is harder. Left main, left anterior descending, left interventricular, left circumflex, marginal coronary artery going down the side. Okay. Right coronary, posterior, interventricular, and yeah, I think in your manual it calls this the left circumflex branch of the left coronary artery. Most people just call this the circumflex. Circumflex and marginal. Okay, you come down here, and we're going down the middle of the back. of the heart. Posterior, I'm trying to do it the way your lab manual says it, posterior interventricular branch of the right coronary artery. The right coronary artery comes off and it does the whole right ventricle, and it also sends down the posterior branch here, interventricular posterior interventricular branch of the RCA, or posterior interventricular coronary artery. Goes down the middle of the back. Easy to tell. Here's on the front, here's on the back. The great cardiac vein, go back to the front. Whither goeth blood, so cometh blood back. So you've got your left anterior descending and left interventricular down here, and you have the great cardiac vein coming back up, particularly when all of these smaller branches come together. That's probably the spot right there that I will choose for the great cardiac vein, which takes all of the blood back out of the front of the heart and starts returning it around. Great cardiac vein comes around. Also adding to it is the posterior interventricular vein that goes along beside the posterior interventricular artery. Artery goes down, the vein comes back. Arteries always go, veins always come back. All of these veins dump into this big fat area here called the coronary sinus. The coronary sinus is where all of the returning veins from everywhere dump into so that it can be returned back to the circulation. Here is the aorta. The aorta, aortic valve out of the left ventricle puts blood into the aorta. Here's the aortic arch. The aortic arch. We'll talk about these blood vessels up here more later, except that there's one interesting thing here. We're going to have two blood vessels going to the left side. One is the carotid, and one goes up to the head, and one goes over into the arm. So this is the brachiocephalic area. This becomes a carotid artery, and this becomes a subclavian artery going over there. But coming out of the top of the aortic arch right here, you only have one blood vessel on the right. It's called the Brachiocephalic Trunk. Very quickly, it's going to break into two, just like these guys. But that's why you only have three coming off the top. Two of them go to the left, one comes to the right, and then splits. We have the superior vena cava is bringing blood to the right atrium. The inferior vena cava is bringing it up from the legs. They join together in the right atrium. Vena cava, superior, inferior vena cava. Coming out of the right ventricle is the pulmonary artery. Now it's deoxygenated, but it's leaving the heart, so it's an artery. It's taking blood to the lungs to get oxygenated. Pulmonary artery, it splits into a right and left pulmonary artery that will then take blood to the lungs. The blood comes back oxygenated in through the pulmonary veins. They look like arteries because they're red, but this is oxygenated blood coming back from the lungs. Pulmonary veins bring the blood back into the left ventricle. I can open it. Yeah, they're bringing blood back into the left atrium, where it can go down through the mitral valve into the left ventricle. So you're getting oxygenated blood back to the left side, atrium, mitral valve, ventricle. There's the cusps of the mitral valve. You can see from the top. Pulmonary trunk, pulmonary arteries, pulmonary veins, superior, inferior vena cava, coronary sinus, aorta, all those blood vessels I just talked about. Now, on your list, you'll also see the SA node, the AV node, the bundle of His, right and left bundle branches, and the Purkinje fibers, but those will have to be on a chart. They don't really show well on here. The SA node is in the upper side of the right atrium, sends the signal down to the AV node, which takes it down into the ventricles. Okay? SA node, AV node is about at the AV junction here, goes down the bundle of His, left and right bundle branches, Purkinje fibers, like that. But anything that I put on the lab practical for that will be a drawing rather than trying to find them on a heart like this, which doesn't show it well. I think that's it for the parts of the heart.